Hello, everyone. It's September the 15th, Tuesday. Now, normally we wouldn't be with you today. Because we were with you yesterday, and we'd be with you again on Wednesday and Friday, and we will be with you on Wednesday and Friday. While we're here, it would be, in my opinion, disrespectful if we didn't go ahead and tell you that we've lost 5 additional West Virginians. Our total death toll in West Virginia is 280 now. Our 276th death was an 87-year-old male from Logan County. Our 277th death, a 93-year-old female from Mason County. The 278th death, a 66-year-old female from Mercer County. Our 279th death, an 88-year-old female from Kanawha County. And our 280th death, a 91-year-old female from Kanawha County. Again, you can see these are our senior citizens that we're losing, and without any question, we've got to some way try as best we possibly can to ensure the safety in our nursing homes from a staff standpoint or any level of visitation or anything like that. We have got to be super careful. And if you've basically gone out of state, especially to Myrtle Beach or some situation like that, self-quarantining is almost just something that you've just got to take on to yourself and do. And we've got to protect our older people. But please, please, please remember these wonderful West Virginians in your thoughts and your prayers, and just thank the good Lord above for all the wisdom that they gave each and every one of their families. I mean, for crying out loud, you just think that probably the average age of these people that we lost an 87, a 93, an 88, and a 91-year-old, and a young 66-year-old. So nevertheless, please keep them in your thoughts and prayers. And they did so much for so many in West Virginia, and we thank them. Okay, our numbers today. Our positivity rate for the daily rate is 4.15. Our cumulative rate continues to grow. It's at 2.65 now. The number of hospitalized is 155, up from 151. And the good part about all this, the rest of that wasn't very good, but the good part is our reproductive number has dropped to 1.27. We're still the highest in the nation, but we've dropped from 1.34, and I think the highest we got was 1.46. So we're moving in the right direction there, but we still got a long, long ways to go. Now, the news of the day, no question, is the meeting that we had last night. We basically called an in-person meeting with all the experts in all the different areas that were consulting with us, and on all the issues from all of our K through 12, higher ed, our medical teams, all the people that I told you earlier were there. Before I get into that, I want to say this, and I think this should be duly noted, but last night at the meeting, someone brought in, basically an email that had come across to where Kentucky has basically adopted our color code system and our plan. Now, there's a few little tweaks that they have that's different in our plan, but really and truly, it was surely nice to see that, that as Dr. Birch thought that our plan was the right plan, and a plan that had been put together with a great amount of thought and everything. Kentucky is following suit now, and all I would say is just this. Just because we had a good plan doesn't mean that we can't make the plan better and better and better. And so with that, without any question in my mind, the orange color code, the delta between the minimum and the maximum of the orange color code is just frankly too wide. Now, hold on just one second. Y'all got to go. I mean, I can't hear myself think for y'all talking. Okay, so So nevertheless, what we're going to do is we're going to insert, as I suggested yesterday, another color to our color code system. And that color is basically going to just do exactly just this. If you'll just think about it, if you were a county with an 11 and you were in the orange color code that went all the way from 10 to 25, how can that county be looked at, in my opinion, in the same way that a county that may be at 22, and the difference is so dramatic that we need to change. We need to do something. Just think about this just for a second. We've got 67,000 kids that aren't in school. And we've got 15,000 of those kids that are special needs kids. If we can safely get some of those kids back in school, should we not try to do just that? Should we not continue to try to change and adapt and make our system even better and better? Well, I think so. And last night, in an emergency meeting that we had with all the experts from all the different fields, we have now come upon a system that is slightly tweaked, but is absolutely better. Now, I'm going to pass at this point in time to Dr. Marsh and Superintendent Birch, and to our SSAC, our head of our SSAC, Bernie Dolan, and they're going to all speak on the different areas of what we're going to do. But without any question, what I have done is tried to listen to everything that has come from our experts, and our experts are truly just that. They're doing a heck of a job, and I give them all the credit and everything, and I've learned absolutely without any question to follow their leads. So Dr. Marsh, if you could take over now, and we'll go from there.
Well, thank you, Governor, and good morning. I'd like to start off by just reminding everybody that this is a pandemic that we've never seen before, that there's no playbook, that this is an extremely fluid situation, and we're learning real time. Now, a lot of people have very strong opinions about different approaches, but I think that the governor has said, and we have said very consistently, that our goal is to try to facilitate and improve the safety and the well-being of our populace. And that is not just on a single dimension. We know that children in school benefit in many ways, not only from an education, but from a development standpoint. We know that food security and resilience building from traumas that many of our children suffer in childhood is importantly met in school. We also know that there's never been a public health map that would do what we need during this pandemic and its ever-changing number of different occurrences. And we also know that West Virginia is a very rural state that has an uneven population center group. So some counties are very, very small, while other counties are bigger. So as the governor has challenged us time and time again to continue to learn and to move with agility and flexibility as we are learning more about COVID-19, we all gathered last night and started to talk about our current system and tried to understand as a team how we could make that system better and safer and more effective for the people that are the most heavily impacted and the counties that are the most heavily impacted. And two things became really obvious from our assessment. So number one is that unintentionally, but absolutely truly, what we have done with the model that we adapted from the Harvard Global Health Institute, a model that looks at how many people newly are defined with infection per day and using an average of 7 days and then correcting that number for a 100,000 population, started to to work in an opposite direction than we wanted, because what happened is every time you get a new case, you actually get a little bit worse on the color coding map. So for a lot of people, the message was received that you shouldn't test, that the fewer tests that we take, the less number of positive cases there are, and therefore you can improve your color. But that is 100% the opposite of what we want to do from a health standpoint. As we've talked about many times, most people that spread COVID-19 are asymptomatic or pre-symptomatic, so we really want to increase testing. And our testing numbers have started to come down, and that's very worrisome for us, because in order to make our communities safer and better and improve the public health, we need to really accelerate testing. So that was one problem with our system, that it actually worked the opposite of what we wanted from a health standpoint, because it actually motivated people to test less as opposed to motivated people to test more. And the second thing is we adapted a model from Harvard that is, a group of smart people, but that model was really just agreed upon by a group of specialists, a group of experts that Harvard had put together. But this model really has been made more so for states and counties with a very consistent population basis, and ours is uneven and not really designed for a rural county. So the governor then asked us, what could we do to try to improve the ability to get more people tested, which is what we want, and also the ability to start to look at how we saw the impact of this system on a state like West Virginia. And what we came up with, which I think is a really important benefit, good tweak, as the governor has said, to the system, is that we really will start to operate in two ways. So one way is we'll continue to look at the infection rate, which was what the color coding map is doing now, with the addition of that gold color, which then starts to separate the people that are closer to the counties that are closer to the yellow versus the counties that are closer to the red, and then facilitate and try to help them reduce their spread. And the second thing we'll do is we're going to add a % positive rate that will also operate on that 7-day rolling average. And so what the Centers for Disease Control have said, the World Health Organization has said, as well as states like New York, that if your positive rate goes to 5% or less over a 7-day average, if you're a larger county, then we will use that as an alternative measure of safety to be able to get back into the gold. So there's two ways for counties to get into the gold. One is to have their infection rate go down, which is what we're hoping happens. But number two is to have that % positive rate go down, because right now most of the orange counties are in the 9 to 10 to 11 to 12 range. And what we want is we want to incentivize those counties to show up to get tested more, because the more you test, the lower that number starts to go down. And by testing more, we're able to identify people that are asymptomatic or pre-symptomatic, which is exactly what we want to do to be able to reduce the spread of COVID-19. And the second thing that we have done, and the governor's already introduced that, and I've talked about it a bit too, is we have added that gold category so that we can start to apply that to counties that have lower population, like our state, but also are much closer to being in the yellow. And as part of that category, and Superintendent Birch will talk about this, but we've also added very aggressive, more mitigation measures, more intervention measures in schools, like mask wearing at grades 3 and up, reducing assembly sizes so that we make it safer and less likely for things to transmit in the schools. And we will call on all of our local health departments to really start to enforce our mask wearing executive order much stronger, and physical distancing. And remember, those work in combination better than each alone. But we really want people to do that because we know from all of the information that we have available that mask wearing does reduce the risk of spreading COVID-19. And there's some new information out that it might even help your immune system, like a mini vaccine, although that's not proven. But the combination of mask wearing and physical distancing is really so important, and we want to reemphasize that, but really work with very closely hand in glove with the local health departments to do that. And then to start to look at the gold counties and the orange counties and the red counties so that we, as we said before, we're treating each county like a separate entity and start to work with our local health departments and epidemiologists, the people that are doing the contact tracing to the identification of who's infected who and where they might have been infected, so that we can very, very precisely, like a scalpel, be able to intervene on those risk exposures, whether they're, in a baseball tournament or whether they're in a bar or whether in a church or whatever, so that we can very specifically try to assist in every way those counties getting healthier. Because eventually we want all the counties to be in green or yellow, but even preferably green, because we've done such a good job at reducing the spread of COVID-19 in West Virginia. And that has really been what's been so amazing so far. And we believe these tweaks will help our children get back in school, help make it safe in the schools, but also be an incentive to test more and to be able to identify the people that are inadvertently spreading COVID-19 in our state. So thank you.
Thank you, Dr. Marsh. So I know that you. So I guess we heard the governor say that it was quite a late night last night and early morning this morning, talking about, for me as a state superintendent, the most important thing was how do we get more children in school? I've been very clear from the beginning that remote learning was going to be tough. We know that parents, we wanted them to have a choice, and we knew that statewide over 70% of those parents wanted their children to be in school. We also knew, after talking to state board members, superintendents, parents, many teachers that reached out to us, they also wanted children in school. So when we heard the governor mention that number, and I'm going to repeat that number, this week 67,000 children were impacted by this metric. And when we started talking with the health officials about a way to safely and healthy get children back into school, I'm all in. I want as many children in person as possible, as long as it's healthy, as long as it's safe, and as long as we're following protocols. So we also know the governor mentioned our children with special needs, our at-risk children. It's just so important. So we have added now a gold column, and I'll ask Jordan if he can put up our document, and it will be posted on the West Virginia Department of Ed site following this press conference. It will be live. And I know that Dr. Marsh mentioned, what does gold currently mean? Well, a couple of things I want to mention about gold is we're going back and we're looking at Saturdays, this past Saturday's map, and we're making the adjustments based now on who could have been gold. We heard the governor yesterday speak that what we're really talking about here are these counties that were so close to being able to be in person, and should they be treated the same as somebody that's trending upwards of 20 plus. And I think that becomes very difficult to tell parents that we're going to treat you the exact same way when the communities are doing what they can to try to mitigate and get those numbers down. So the map will be released, and what this will mean is that we want to put the ownership of this in our local boards and our local superintendents' hands. So they're going to be able to see an updated map and really make a decision of starting school based in gold, what they would have been Saturday. We will release the map again, another map, just like we do this Saturday for Monday. But we don't want to make this real confusing. I will be meeting with all superintendents to walk them through this later today, And a couple things that I do want to note, though, that when we're talking about a county that is or gold, what does this mean for additional safety precautions? And first and foremost, it means that we will be wearing a mask at all times. A face covering will be required for grades 3 through 12 at all times. We also are going to reduce and have no assemblies or large activities within the school. We're going to work on keeping those children in elementary and cohorts as best we can. We're going to limit the transactions and movement around the schools as best we can in our middle schools and high schools. And we also are going to be monitoring, continuing to monitor our supply of face coverings, sanitation. We know that we have now the Guard and the National Guard and the DHHR to support us, but we're going to be asking each and every principal and every single superintendent to be monitoring those. We knew we had enough to start school. I want to know exactly how those are being used, and I think that's important to everybody. And finally, I do want to say that we really want to take this opportunity to get our local school systems and our local health departments to collaborate and include the National Guard. You know, Dr. Marsh has spoke of increased testing and the need for it. We've heard that you know, we don't want people to fear the testing. It's valuable information, and you know, we rely on our schools for so much within the community, and there's no reason that these schools cannot be sites to where we encourage families to come in and get tested, not only for knowing yourself, but to help with that as much as we can know about the community as possible. So again, we also have an updated map. If Jordan, you don't mind putting it up, it'll be posted live. You can see the counties that will be impacted, looking at the new gold, which is, Dr. Marsh, I believe, 10 to 14.9 cases, as well as another route which would be 5% or less of positivity rate. So you can see that that does impact Putnam, Fayette, Logan, Mingo, and I'm looking for one more there, Boone County. We will reach out to each one of those superintendents following this call to make sure they completely understand what the change is. And again, as the governor and I have spoke, and we have spoke to our state board president, Miller Hall, we want this to be a local decision. We want them to be able to do what they need to do for their community, and I think this absolutely allows them to do that. And the number one thing for me is that this puts more children having access to their teachers, and that is the number one goal.
Good morning. As the number of schools increase, obviously the number of athletic teams, extracurricular activities that are on the schools that are in the gold, yellow, and green will increase. And so we wanted to reflect that. We've been very focused in our office of not only trying to have the events, but we wanted to try to make sure we have a whole season of events. So we've been very measured in our attendance. So as we move forward, we told them originally that we would look at our attendance as well as some of our other features. As you look at the map or the chart that Superintendent Birch put out, you know, the things that change for us, for the activity part, under green, you now will have, the playing will not change, but you will be allowed to have grandparents in attendance. And we know grandparents play an important role in the education of all these children. Oftentimes, they're the ones who are taking them to and from games and practices. So we think it's a great opportunity to expand that. It is also in yellow. The grandparents, along with the immediate family, will get to go in yellow. In gold, there's going to be some restrictions with athletics. The extracurricular activities are in county or only with other gold counties. And again, this one is going to be limited to just parents and grandparents, or parents and guardians only. When we get to orange, we did make a little tweak on orange because we're going to define what conditioning is, and we will set that out to the schools when we get back. And so they'll clearly have a understanding of what those mean. But I think our administration during the games has done an incredible job making sure these opportunities are there for the students as well as the parents and guardians. We wholly support the increased testing, and hopefully everybody gets on board because that's how we're going to know the health of the community moving forward. Thank you.
Okay. Did you come back to me, Jordan? Okay. Let me try to summarize. First of all, I thank all those that were in attendance last night, and and I especially thank these three gentlemen that have come today. We had, Secretary Crouch, Dr. Amjad, Sarah Tucker with our higher ed. I can't recall exactly if am I forgetting anybody else there? But well, I may very well. And then all my staff. So we had a lot of people that were there last night and going through everything to make sure we had it right on the money. Now, I want everybody to really pay attention to me because I'm going to take what they're saying and I'm going to make it in my words, and in my words, they have always been just point blank. I've told you the truth. You have given me your faith and confidence, and I am not going to let you down on that. Now, I'm tickled to death to see Kentucky move to our color-coded system, but it doesn't really matter to me from the standpoint of anything other than the fact that you've got a bordering state that is looking at us and saying, what they're doing is good stuff. And the other thing is Dr. Burke, absolutely endorsed what we were doing. Now, with all that being said, last night we met, and I want everybody to pay real close attention because I'm going to make this very, very, very plain talk. Last night we met from 4:30 to 8:30. We told you we were going to come back and give the media an hour's notice and everything, but it just got too late. And so we notified everybody we had to come in today. During that time, I surely do what I always do, and that is listen and try to make things better. Now, in trying to make things better, I am a full believer in just this. We went to the moon at one time. What's the difference between going to the moon and trying to figure out what are you going to do with a pandemic that nobody's ever seen before? To me, there's so many similarities. But going to the moon, can you imagine the times that we had to change and adapt, and then we landed, and we brought our people back safely. Now, so that's what you have to do. In critical situations, you have to do that. And I hope and pray that everybody understands that that is the prudent and the smart thing to do. Now, we've got 67,000 kids that are out there, and a lot of them have never even had the opportunity to start because they started with, they were orange, and we just didn't feel comfortable and everything. They didn't even have a chance to get out of the blocks. Now, of those 67,000, we think there's 15,000 of them special needs kids. Now, we can sit on the sidelines and let this go and not change and be stubborn and not adapt. And really and truly, at the end of the day, what would it be? It would be worse, and it would be a bad, stubborn move. So what do? You change and you adapt. Now, I want to explain something. I want to explain it really clearly, and that is just this. We have a model that we're going by right now called an incidence rate. Now, I know that for you that are listening is complicated. So we're going to change that name to an infection rate. Now, in the infection rate, if your county does 100 tests and you get 12 people positive, it negatively impacts your county from the standpoint of your color code. Well, now what does that do? If that negatively impacts your county, then we have, whether it be coaches or people or whomever, we have people that make decisions that say we should not test because the more we test, the more we hurt ourselves. Now, we can continue on that path or we can try to adapt and change. Because that path gives us not good information medically, it doesn't help protect you, and in addition to that, it just gets worse and worse because all we test then are the sickest. We don't ever test anybody that could be asymptomatic, we just test the sick people. And therefore, your county then just gets worse and worse and worse with one rate, and that is the infection rate or the incidence rate. That rate right there is causing your county to get worse because we're not testing. And in addition to that, we don't have knowledge to help you. And in addition to that, we have more and more sick people that are testing negatively, or positively rather, and that makes your county worse from the color code system. So what we've done and what they've explained, but I want to make sure that you understand exactly, we've added an either or, whichever is less for your county. Do you understand what I'm saying? This now becomes either or, whichever one, because now we've added the positivity rate that your county has to get below 5%, which was the rate, the standard, the gold standard that everybody came out with. Your county has to get below on a positivity rate, which is completely different than the infection rate. Totally different. You have two different ways or pathways to a color code. You have an infection rate and a positivity rate. The positivity rate is driven by just this, the number of tests versus the number of positive and everything, and that calculates the rate. So on this side, the positivity rate is telling you, go get tested. It helps us medically. It helps you from the county standpoint. It helps us from the knowledge to be able to pick up on people that are spreading this disease and don't even know maybe they have it. It will help us in every way. Now you can do one of two things. You can sit back there and decide, I don't want to get tested, and the more that I sit there, then the only people that we're testing in your county are the sick people. And what do you think is going to happen? It's going to drive or skew the numbers in your county toward a poor color code. On the other hand, if you get tested from the positivity standpoint over here, it may very well skew your county to a lower and a better color code. And not only that, it'll give us lots and lots and lots of good information. Now, it becomes now either or, and whichever one gives you the better color code is the way it's going to be. Now, from Monroe County, we had to start somewhere with this new color that we put into play, the gold color. We started on Saturday night. As of Saturday night, last Saturday night, you were in the orange. Monroe County, you're trending in a great way, and I truly believe that coming this Saturday, I'm hopeful that you'll get all the way to the yellow and be willing and able to go. Now, again, you gave me your faith. You gave me your confidence. I'm going to continue to lead, and I'm going to continue to do what's right. The naysayers that are out there that are saying all this and all that and everything else, if you choose to listen to them, well, there's nothing I can do about that. You know, the people that are sitting on the sidelines, the Monday morning quarterbacks, they've got all the answers and everything else, and yet they may have even decided, you know, to cut funding in their own county, in a county that is exploding, and they decide to cut funding, you know, and then they can sit on the sidelines and criticize. It's ridiculous. It's totally ridiculous. They don't have a clue what in the world they're doing, and on top of all that, They're not listening to all this team of experts that we have here. Now, it's tough stuff. It's really tough stuff. For all these people here, forget me, but just think about all these people here and all the other people that I've mentioned and all the people that are making the numbers happen everywhere. It's tough stuff. Nobody has a guaranteed pat answer. Absolutely. We should all be concerned. We should all be concerned about everything coming or going. But I want to just end by just saying just this. There's no question that I think you should adapt and change. There's no question, first and foremost, that we should hang a banner that should be here forevermore. It has to be safe. It's got to be safe for our kids. It's got to be safe for our teachers. It's got to be safe for our service personnel. It has to be safe. Now, in addition to that, if we, I want to just make a couple other announcements to just tie this up. From the standpoint, and I think we've missed this, but from the standpoint of our gold, orange, or red counties, we will not permit any travel ball in those counties now. Absolutely, from the standpoint of our health care community and everything, our health officials in those counties, we will urge them as strongly as we can to enforce the mandatory order of wearing masks. We will look and continue to look at any and everything in those counties that are on the table. I mentioned to you in Fayette County that the Golly situation could very well have, be causing all kinds of issues. We have investigated and looked at that, and what we're finding is just this, and we got to do better with this. But we're finding that a lot of people in that county themselves are not abiding by the guidelines, wearing masks and doing whatever they need to be doing. We're absolutely trying to tell you that if we have a bar or something like this and it's overrun with people, then call us. Absolutely, abide by the guidelines. And if we have to move in and be more restrictive to the people that are wanting to come to run down the Golly River and everything, if we've got to be more restrictive to stop this terrible killer, we will be. Because we're going to protect the people in our own county. We're going to protect the people in Fayette County. Absolutely we're going to do that. Now, if it takes additional measures, we're here to do them. I strongly believed that what we needed to do was tweak our color code system and add another bracket to be able to get a lot of our kids and give them the opportunity to be able to get back in school. Now, it's just as simple as that. I hope I've been just point blank, and I hope that you understand that first and foremost, it's got to be safe, but absolutely without question, without doubt, as you go through life with a difficult problem, you've got to be willing to pivot and change and adapt and make those changes for the betterment of all. And that's what these great people are doing. And I appreciate them more than you'll ever know. And we're going to continue to do just that until we hope and pray we're going to get to a point in time where really and truly we're going to all run across the finish line, and we're going to remember all those that we lost, but we're going to all run across the finish line with that vaccine that we hope and pray will come real soon. Thank you so much.
All right, thank you, Governor and panel. Bill Crouch and Dr. Ayn Amjad from the DHHR are both joining us today and are available for questions. Major General Hoyer with the West Virginia National Guard had a previously scheduled engagement, but he will be with us again at tomorrow's briefing. We'll now go to questions from members of the media. The first today from Steve Adams with Ogden Newspapers.
Yes, Steve Adams here with Ogden Newspapers. I know you keep comparing the tweaking list to the Apollo moon landing, but these don't seem like minor changes. They seem quite a bit different from what we started with on August 17th. And I know they've gone through some reiterations, but I had a conversation with one of my editors this morning who was trying to make heads and tails of this system, especially since obviously over the weekend, Calhoun County was in the orange, but by Saturday night, it had been tweaked on the Department of Education map to be in the yellow. So there's still a lot of confusion out there. How does this not continue to add to the confusion that is out there from parents that are trying to determine exactly, you know, if their school's going to reopen the next day or if their schools are going to be closed? Can you talk a little bit about that? Thank you.
Stephen, I can. On one hand, I think, you know, when I think about our moon landing, how unbelievably how big it was. Well, if you think about this pandemic, where we've almost lost 200,000 Americans, almost approaching 4 times the number of people we lost in the whole Vietnam War in 13 years, it's pretty big stuff. It's pretty daggum big stuff. And I'll promise you, along the way in the moon landing, they had to tweak things, and some people thought they were minor changes, and others probably thought they were big changes. In my situation and where I'm at right now, to me, you know, when you're looking at that orange level that moves that goes all the way from 10 to 25, and you're looking at the yellow level that goes from 3 to 10, you know, anybody in their right mind would look at that and say, wait a minute, maybe, and we took that off the Harvard deal, and maybe, just maybe, that's too wide. And so that's what we're trying to do. We're trying to narrow that down just a little bit, and we're trying to also give some level of hope. You know, if we lose hope, we're really in trouble. And so from the standpoint of a Kanawha County or a Mon County or whichever county may be, to try to get themselves down to where they can go to school and their parents, you know, don't have to worry about daycare and on and on and on, we got to have some level of hope. And so with this, we think we can tweak that orange bracket just a little bit, keep it really, really safe, put in the measures to make it even more safe with wearing the mask from 3 through 12 in school, you know, or 3rd through 12 in school. And you know, so we can do things to make it even more safe, but we can tweak that and make it safer and make it better. Now, you know, Stephen, at the end of the day, you know, I truly believe that we've got to try to do any and everything we can to get our kids back in school and give them the opportunity to go to school. We have so many extra type of needs and everything, and we got to do it as safely as we possibly can, and that's what we're trying to do.
All right, thank you, Steve. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. A couple of quick questions. First of all, Governor, I'm a little fuzzy on the turning orange in the code. If you turn orange, I thought that schools were immediately closed down, that you tweaked that last week. And Lincoln County under the old map would have been orange, and yet they've been in school this week. So if you could clarify that for me, I'd appreciate it. And secondly, there's a question about positive tests. Individuals who test positive and then health departments don't test them multiple times. After 14 days, those cases are considered resolved. But private medical companies are retesting people, especially those who need a negative test to report back to work. So we've been told by some healthcare providers that some people are testing positive 8 and 9 times once a week in order to try to get that negative test to go back to work. How do you think those tests, which are then reported to the statewide numbers, could be possibly skewing the map and inflating the number of positives?
Kenny, we discussed that last night. In fact, I brought it up, and we discussed it with Dr. Amjad and the DHHR, head Secretary Crouch, and that's something that we're trying to review and make sure that it doesn't happen. but that's a potential problem and everything that we're trying to clean up, and as well as the possibility of trying to do something with the universities and everything as far as their congregate, possibilities, where we've got people in one dorm and move forward with that. But that is a very, very legitimate question and everything that we're working at.
All right, thank you, Kenny. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, you just mentioned it just a second ago, but what was the results of discussions about what to do with WVU and your suggestion about, sequestering these students so we could count them as a congregate setting? Have you discussed that with university officials as of yet?
Well, I've surely discussed it last night, for a good while with Sarah Tucker and Dr. Clay Marsh, and they're discussing it with the officials at WVU. And actually, to tell you the truth, Charles, what we've decided is we're going to kind of defer that until tomorrow. And the WVU people are working on that and everything, but we don't have it finalized yet. But everybody's working on it as hard as they possibly can. I can tell you that the WVU people are doing great.
Thank you, Charles. Next to Mark Curtis with Nexstar Media.
Good afternoon, Governor and staff and cabinet members and fellow press members. I'm getting bombarded, and I mean bombarded by texts, emails, phone calls from people who are still not getting this new unemployment, the $100 from the state, the $300 from FEMA, or they're getting their regular unemployment but no supplement, or some people are getting nothing at all and they believe they're still entitled to benefits. I wish Scott Adkins was here, but can you address what's happening with unemployment? We're 2 days into the week and a lot of people thought they were going to get checks this week, and so far they haven't.
Well, Mark, you're right. We're 2 days into the week. I was told through Scott Adkins and everything that those checks would be going out the first of the week and everything. And all I would say is just this: those checks are coming. I think Scott Adkins would say that his people have done as good a job as they can possibly do to be able to get through the FEMA guidelines and to get through the fraud guidelines and to be able to establish a system to be able to get you paid. And from my standpoint, I'm one of 4 governors that stepped up and said, do the other $100. So I'll promise you, from my standpoint, I've done everything that I can possibly do. And so all I would say is I get it that people have got car payments, they got rent payments, they absolutely been sitting there waiting. This is all at really not fault of theirs. This pandemic just fell in everybody's lap. We've lost jobs all over the place and everything. I get it wholeheartedly. I want nothing but those people to be taken care of. I've stepped up to the plate and said, do that and everything. And now it's up to workforce, and they've got to go with it. And tomorrow we'll have a further update tomorrow, I'm sure, and Scott will be with us.
All right, thank you, Mark. Next to Emily Allen with West Virginia Public Broadcasting.
Hi there. My question would be for Clayton Birch. Superintendent, you've said since the beginning that, you talked about how remote learning and online learning would be difficult and you want as many students in school as possible. I mean, we've been in school since earlier this month. For families that still want to practice remote learning, what is the state going to do that's new or might help them more with remote learning, or is putting more students in school really the only and best option for that?
Oh, thank you. No, I'll stand by my original words. Putting students in that parents have chosen in face-to-face instruction is by far the best. However, that does not alleviate any pressures we have to support our families that chose to go virtual. So we have virtual learners. I think we're pushing around 60-some thousand that signed up for virtual. I'll be honest with you, the first week of school, we've had several that have asked to go back in person. It is really difficult. They find that it's not exactly what they thought, but we want to support each and every family. And if they decide to go virtual, we're going to support them. And our staff will continue doing that. The issue you bring up about remote is a bit different. Remember, these are the families that wanted to be in person. We're trying everything we can to get them back in school. They did not initially sign up. They know their children best, and they know the resources the school brings to face-to-face.
All right, thank you, Emily. Next to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. Governor, you said yesterday that decisions would not be swayed by protesters or anyone from D.C., but I couldn't help but note that, as a matter of fact, you had to walk past dozens of protesters on your way into yesterday's briefing. Are you sure public sentiment has no role in the decisions being made? Thank you.
Well, Brad, just to be as honest as I know how to be, we always want to listen to public sentiment. I mean, do we not? But I had made my mind up way before I ever got down here yesterday, of exactly where I thought we needed to be. I had listened over and over to all the experts in lots of different ways, and all I could think about was just the fact that we had so many counties that were just barely over the edge from being out of the yellow that weren't in school. So many kids, so many parents that didn't know what to do with daycare, so many economic impacts of it, so many kids that needed to have the opportunity to go to school. Now, people could say, oh yeah, he's just saying that, and that's, but really and truly, if they choose to say that, I don't care, because I know how I feel. I love our kids, and I want goodness for our kids, our teachers, the service personnel. I want goodness and safety for all of us. But I can tell you that I just felt in my heart that absolutely this was the right move, and the right move for us to make. Now, is it a guaranteed move? Of course it's not. But really and truly seeing all those kids and stuff, that were out there and everything, and they were voicing their right to be here and everything, in so many ways it's good to me. It's really good that they have that much passion and that much interest to be here. Now, I hate it like crazy that they're basically yelling at their best friend. They're yelling at their best friend, the friend that really wants exactly what they want more than they could ever know. But at the same time, I'm not going to let that or any influence from D.C. or any influence in the world cloud my mind to make the wrong decision. And that's what I said. And I'm not going to do that, Brad. I've been around the block a bunch of times. That's why I've said over and over, this job is not for the faint at heart. It's a big boy job right now. And really and truly, that's why, I'm here, and that's why I believe God has put me in this position. And, dag, it's tough. I mean, it's really tough. But I've been there before. You talk about being battle tested. I've been that in lots of different situations all through my life. And so I'm not going to be influenced by others. I'm not going to be clouded. I'm going to make the decisions that are the right decisions. I'm not going to make the decision by mood. I'm not going to do that.
All right, thank you, Brad. Next to Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron with WSAZ. Can you guys go ahead and explain exactly where that local control comes in? If the numbers are still determining what the color is, if you can explain the local control. And then also I wanted to clarify about travel ball, what exactly that entails, how it will be enforced, and what it would also mean for like dance troupes and things like that who travel from county to county. Thanks.
So thank you, Amanda. So your first part of your question I'll tackle, and then I'll turn it over to Mr. Dolan. So the local control comes in a lot of different ways. One, you remember we asked each district to create a plan for reentry. Many of these districts we've heard had multiple plans based on whether it was a hybrid or blended model, 5 days a week. So the local control, especially for this week, is really, really important. If we go back and look at the Saturday map and we adjust based on the new Gold Keller, we have several counties that will have to make a decision of Do they want to open up this week and go ahead and get children in school sooner? Or do they want to wait till the map comes out on Saturday and tackle this on Monday? And we're really leaving that up to those superintendents and county boards to decide. And then also, we continually meet with the county superintendents. Many of them are looking to do, I'm going to use a word that apparently, it seems to be the theme about this idea of tweaking. But we keep seeing that maybe the governor we hear is tweaking the color coding map. But let's be clear, we have superintendents that are looking locally to tweak their own plans. They're now in this, they're seeing what's working, they may be adding days, looking at different models, and we actually are encouraging each and every one of them, yes, continue to adjust your plan to meet your family and your children's needs, because nobody knew exactly when they put these plans and submitted them August 14th. Not one of those superintendents knew for sure what exactly was going to work.
Okay, and thanks, Amanda. The travel tournaments that we're talking about are events, sports that are sanctioned by us that they would be bringing in from out of town and having large groups brought in. So those are the things that we're trying to bring on an even playing field with our local schools.
All right, thank you, Amanda. Next, we'll go to Taylor Stuck with the Herald Dispatch.
Hi everyone, it's Taylor. This is probably for DHHR or for Dr. Marsh. To increase our testing, what else can we do? I mean, the state, you have these free testing events and those are great, but outcomes seem to be changing a little bit, but maybe the map will fix that. But then I'm also hearing it's just hard for somebody who has no symptoms to just go get a test, especially if you don't have insurance or just a regular doctor, which a lot of people, even if you have insurance, don't have a regular doctor. So how can people start getting more access to testing other than the free testing that the state is helping with?
Taylor, let me take this, and I think I can handle this really simple, okay? The National Guard is going to, gave us assurance last night through General Hoyer that they're going to provide and give us amped up testing capabilities that are significantly higher. We're going to try to target naturally our red or orange or our yellow or gold counties first, but we're going to significantly amp up our testing abilities and do that in starting with Mon County. But I think we have 2 units that are going to Mon County today or that are on a super rush basis. But in addition to that, we're going to be going to all the counties, and absolutely please take advantage of getting tested. It will give us so much information. It will help your county from the standpoint of your color coding. And absolutely, without any question, it will make us safer. It will make us get better and better and better and better. So with that, the National Guard's all on board. You're going to see that, and you're going to see that happen all over the place. And that testing is not going to cost you anything, zero. And so with all that being said, we don't want people having to go to Medicare or wherever it may be and paying for tests and going on and doing all that. I don't want that. I want the other. I want us to be able to test our people and it not cost our people and it be painless and it be very fast and be able to get them through and get it done. It will really, really help our health community to be able to make great, great decisions. And the other thing is just this. Now, the other thing we need to say is just this, is if you're tested positive and you want to be tested again and everything else because you don't think that you could possibly be positive, we'll test you again. And in addition to that, as we go forward, like I said over and over and over, we want to be sure and scrub the numbers. Kenny Bass, was a terrific question. We have situations where we have a person that is tested positive. They're wanting to go back to work. They're now completely, they've been through their quarantine or whatever for 14 days. They absolutely feel perfectly fine. and everything, and maybe an employer requires a negative test. And so they're tested again, and maybe they come back positive again and everything. Well, is that counted 2 times in our system? We need to be sure that it's not, but there's so many aspects like that that we're trying to deal with, and we're trying to get through it in the right way.
All right, thank you, Taylor. Next to Christina Cass with WVVA.
Yes, this is Christina Cass with WVVA. So to clarify, when exactly will this gold code be enacted? And along with that, what does this mean for nursing home protocols also for the future with this gold code?
Okay, Secretary Krause, well, let me answer the front end. The gold code goes into effect right now. And so that's why we've left it up to the superintendents to decide, whether or not, that they're going to go into school tomorrow, or they're going to wait and they're going to see how the coding comes out on Saturday night. It could very well be that you could be in the gold today and go back to school right now, and you could possibly flip to the yellow, which would be great, or you could slide into the orange, and if you slide into the orange, we're not going to go back to school in the orange. And so nevertheless, that it will be left up to the superintendents and the local superintendents as to whether or not they want to immediately go back to school or wait. Now, Secretary Krause, you're going to answer the tail end of her question.
Yes, Governor. We will have discussions with the nursing home folks this afternoon. We don't anticipate a change with regard to the nursing home visitation and the maps at this point, but we will have those discussions this afternoon and provide any changes tomorrow in the press briefing tomorrow.
All right, thank you, Christina. Final question today comes from David Beard with the Dominion Post.
Hi, I have another testing question. For people who are asymptomatic and decide to get tested, they may have to wait 5 or 10 days for the results. So during that period, you kind of have to cancel your doctor appointments, not go to the store. And so maybe they're going to wait till they feel sick to go get tested. How do you incentivize the asymptomatic people who don't want to cancel their lives to get testing?
Well, David, that's why I say over and over and over, this is tough stuff, because everybody's got a wrinkle and says, well, what if, what if? I think you just ask it, if somebody's asymptomatic, how can we encourage them to go? Because if they go and they would happen to test positive, then they may not be able to go to the store for a week, and they're going to sit back and wait till they get really sick and then come and get tested. Well, David, I have no idea how to answer that, other than to say, if you have any level that of anxiety, that you could possibly have an issue, I don't know how in the world you would wait, because the longer you wait, the more probable you're going to become one of these statistics that I read every day. If you wait, you're going to make it tougher and tougher and tougher on our medical team to get you through this. And so I know going to the store is really important and everything, but I don't know how in the world, if you have free testing available to you, you couldn't just take advantage, because it's just going to make a better peace of mind for you and a much, much, much safer situation for you and your family and all your loved ones, everybody around you. So I don't know how I can encourage any more than just doing exactly that.
All right, Governor, back to you.
Well, let me end by saying this. Parents, I know it's confusing. I don't know how to not make it anything but some level of confusing. But we try to give you as clear a path as we can possibly give you. And there's lots and lots and lots of people that are out there that can clarify and everything for you. Now, we could just say this. We could say, everybody's going back to school tomorrow. And then if we have a big, big problem, then we would maybe have to say, everybody can't go to school after that. You know, with all that, there's every intangible problem that you can possibly imagine. Everything in the world. So it's got to get some kind of difficult if, in fact, we're going to be able to move forward. And then it becomes confusing. But that's why we come every day or every other day and we try to explain. That's why we try to tweak. That's why we meet hours and hours. That's why, in all honesty, it's tough to sleep, because we know that we're dealing with a life and death matter that nobody's ever dealt with before. There is no playbook. I've said it over and over and over. You know, that's why we tweak and we change and we adapt. And in this situation right here, we have made what I think are real live improvements to what we're doing. We're trying to tighten down and put more things that are more stringent. We're trying to relax in the counties that are so close to being able to go back to school. We're trying to not leave 67,000 kids out of school. We're trying to absolutely not trying to inconvenience those parents. We're trying as hard as we can to change and adapt and make it better. Now, we've done that. And I know it's slightly confusing. In fact, I know that it's very difficult at times to figure it all out and everything, but there's so many resources that you have as parents to be able to do that. So as we continue down this path together, hand in hand, we've got to have you with us. This is tough stuff. And if it were easy, it would be a piece of cake, but it's tough stuff. So we've got to have us all pulling this rope together, and I hope and pray we will. Thank you so much for being with us today.